Hello and welcome to Guidance on Hand Hygiene Training, Assessment and Audit in the Workplace. This guidance is designed for both primary care and care home providers and will give recommendations on hand hygiene training content, hand hygiene competency assessments and recommended audit practices. The following slides are recommended training content when delivering hand hygiene training. Please feel free to use them within your workplace. Healthcare-associated infections. Healthcare-associated infections were previously defined as hospital-acquired infections. However, most modern healthcare is now delivered in the community. Healthcare-associated infections are most commonly respiratory, for example, chest infections or community-acquired pneumonia. 30% are avoidable. There are over 300,000 cases per year, and they cost the NHS billions of pounds due to longer inpatient stays, additional tests, interventions, treatments, and bed days lost. Outbreaks can close down services and prevent service users from getting the treatment they require. If a patient or a resident survives sepsis, they can be left with long-term conditions such as post-traumatic stress disorder, physical disfigurements, life-altering disabilities, and financial burdens. The chain of infection represents the stages required for a germ to be able to infect a person. With infection control, we are looking at interventions that break the chain of infection at as many points as we can. If we start in the top right-hand corner, agent is a microorganism or a germ that causes disease. For example, norovirus can cause diarrhea and vomiting, or influenza can cause a flu. Examples of interventions that break the chain at this stage would be completing a prescribed course of antibiotics to reduce the opportunity for the pathogen to become resistant to treatment. The next stage in the chain is a reservoir, which is where germs live and replicate. For example, this could be a person, the environment, or food and drink. An example of breaking the chain at this point would be regular cleaning, which will reduce the number of pathogens present in the environment and on equipment. Another example may be isolation or social distancing, keeping away from others when infectious. This will reduce the opportunity for the pathogen to find a new host. The next point on the chain is a portal of exit, and this is how pathogens leave the reservoir. This could be through coughs and sneezes of someone with a respiratory illness such as flu, or through the feces or vomit with someone with gastroenteritis, and diarrhea and vomiting. Examples of breaking the chain would be covering nose and mouth when coughing and sneezing to reduce the chance of spread of respiratory infections, and also having dedicated toilet facilities and access to vomit bowls to reduce the chances of spread of gastrointestinal infections. The next point on the chain is the mode of transmission, how germs move from one person or place to another. This could be from one person's hands to another, through touching a contaminated object, through the air, or through contact with blood or bodily fluids. Hand hygiene would be an example of breaking the chain at this point to remove as many germs as possible and to stop their moving between people. Another example may be improving ventilation to help dilute certain germs in the air, such as viruses which cause respiratory illness. Next on the chain is the portal of entry, how germs enter another person. So this could be through inhalation, through mucous membranes, through the lining of the nose and mouth, or via a wound or an invasive device such as a urinary catheter. Examples of breaking the chain would be fluid-repellent surgical face masks and eye protection to reduce the risk of pathogens entering the body through the mucous membranes, and also ensuring any wounds are covered, as well as only using indwelling devices such as urinary catheters when absolutely necessary. The last point on the chain is the susceptible host, the person who is vulnerable to infection. This could be for a variety of factors such as age, low immunity, or any other underlying health conditions. An example of breaking the chain at this point would be vaccination to help the person fight off infection and prevent disease, illness, and death. Standard precautions are interventions that we apply in every healthcare situation and contact to reduce the risk of transmission of germs from both known and unknown sources. Please click the links embedded within the PDF version of this narrated presentation. The April 2022 NHS England National Infection Prevention and Control Manual outlines in detail the 10 standard precautions, which are patient placement and assessment for infection risk, hand hygiene, which is acknowledged as being one of the most important activities that breaks the chain of infection, respiratory hygiene, so think catch it, bin it, kill it, personal protective equipment, management of medical equipment, management of the clinical environment, management of linen, management of blood and bodily fluids, management of waste including sharps, and occupational safety and managing prevention of exposure including sharps. The hierarchy of controls is a system for controlling risks in the workplace. It looks at either eliminating or reducing risks, and it ranks control measures from the highest level of protection and reliability through to the lowest and least reliable level of protection. So as you can see from the table, control measures which physically remove the hazard eliminate risk and are the most reliable control measures. Next in the table is substitution, which replaces the hazard. Engineering controls isolate people from the hazard. Administrative controls change the way people work. Personal protective equipment is the least reliable control measure and should always be used when all the other control measures are in place, but there still is an unacceptable risk of transmission. The following are examples of control measures in the hierarchy of controls. Examples of elimination, physically removing the hazard, are deferring face-to-face appointments when treatment is not urgent, not coming into work when ill, closing services, and vaccination. Examples of substitution control measures which replace the hazard are switching processes or practices, for example, reviewing treatment areas, virtual healthcare appointments, not eating or drinking in the clinical environment, and reducing communal activities. Examples of engineering control measures which isolate people from hazards are isolation room provision, adequate mechanical or natural ventilation systems. Hand hygiene is an engineering control measure which isolates people from the hazard. Respiratory hygiene, so catch it, bin it, kill it, ensuring equipment is in a good state of repair so it doesn't have any rips or tears or anything like that. Cleaning, decluttering, and ensuring water safety, so thinking about little used outlet flushing. Examples of administrative controls, so changing the way people work, remote meetings, screening, triaging, testing, reporting infections promptly, appointment or clinic scheduling to reduce waiting times in reception areas and avoid mixing of infectious and non-infectious patients, isolation of cases with known or suspected infection risks, infection control training, appropriate signage, restricting visiting, reducing numbers of people in an area, allocating staff to affected areas, and surveillance of infections. As discussed earlier, PPE is always used as a last resort when all the other control measures have been implemented, but there is still an unacceptable risk of transmission of infection in the workplace. PPE should also be worn when there is exposure to blood and or bodily fluids, non-intact skin or mucous membranes. And it's very important to remember that PPE will only prevent the spread of infection if it's accompanied by good hand hygiene. Otherwise, it can increase the risk of transmission if hand hygiene isn't done at the right times. Bare below the elbow. It's really important to remember that hand hygiene cannot be achieved if you are not bare below the elbow. So that doesn't just mean no long sleeves. It means no Fitbits, watches, bracelets, stoned or lattice rings, or nail enhancements. It's really important to maintain good skin condition to avoid sore hands. So please make sure that you do apply hand cream on a regular basis when at work. And if you do find yourself getting dry, red, cracked, sore, itchy skin, that you seek help for these problems. It may be dermatitis, so please get in touch with your GP or occupational health department if you have one. These are some examples of good practice when it comes to being bare below the elbow. So making sure that your sleeves are short, that you have no stoned or latticed rings, one plain wedding band is permitted, and making sure that fingernails are clean, there are no nail varnish, and that fingernails are no longer than the tips of your fingers. This slide shows examples of bare below the elbow bad practice. Things to consider when it comes to good hand hygiene. Germs can survive on surfaces for long periods of time and be transmitted from person to person via poor hand hygiene or lack of cleaning. Germs can then be spread by being ingested. This is called the fecal-oral route of transmission, which means that germs are spread via the environment when somebody has diarrhea and vomiting. And if hands are not cleaned properly or the surface is not decontaminated properly, then the feces or the vomit can be transmitted to another person's hands, who may then ingest them if they do not perform good hand hygiene when eating and drinking. Please make sure that staff and service users' hands are washed with soap and water before eating and after toileting to break the chain of transmission in the fecal-oral route. Appropriate donning and doffing of PPE is the most important part of wearing PPE. If hand hygiene isn't performed at the right times, then PPE may not protect you and others and can also increase risk of transmission. The World Health Organization 5 Moments of Hand Hygiene. Please click the links on these slides to download the 5 Moments of Hand Hygiene posters. There is one for patients, and there is one more appropriate for care settings with a resident in the chair. The 5 moments of hand hygiene are before resident or patient contact, before a clean or aseptic procedure, after exposure to blood or bodily fluids, after patient or resident contact, and after contact with the patient's surroundings. Choosing the right product. It is really important to make sure that you choose the right product when you are performing hand hygiene. This slide shows the pros and cons of both alcohol-based hand rub and soap and water to help you make the correct decision in practice. Alcohol-based hand rub works by killing germs, and it can be used in situations with no immediate access to hand washing facilities. However, it is only effective in concentrations above 60%, and it is the drying action that kills the bugs. Therefore, it must be rubbed in until dry in order to be effective. Alcohol-based hand rub is ineffective if hands are visibly dirty, and it is also ineffective against certain bugs, for example, norovirus, C. diff, and parasites. Soap and water works by manually removing germs from the hands. Antimicrobial soap will kill the germs. Soap and water must be used after contact with bodily fluids, after using the toilet, and before eating. And it must also be used when hands are visibly dirty and after contact with a patient or their surroundings if the patient has diarrhea or vomiting or known norovirus or C. diff. The cons of soap and water are that it requires access to a clean sink, soap and paper towels. And also poor product or poor hand washing technique can contribute to contact dermatitis. So it's really important to make sure that when you're using soap and water, you perform the right technique, which we will go through in the following slides. This slide represents the most frequently missed to the least frequently missed areas when performing hand hygiene. The most frequently missed areas when performing hand hygiene without the right technique are the webs of the fingers, the tips of the fingers, and the thumbs. And the areas we tend to most concentrate on are highlighted in white. This is the correct technique shown on the screen when washing hands. Please make sure that hand washing technique posters are placed at hand hygiene points throughout your clinical or care setting. There are links at the bottom of the screen for a hand washing poster and a hand rub technique poster that you are able to print out and use. If delivering this training in your setting, please click the links on the slides or in the PDFs which are on the screen right now to show staff in your setting. The first one is a Royal Cornwall Hospital Trust fun take on hand hygiene titled Let's Wash. The second is a World Health Organization instructional video on how to hand wash with soap and water. And this slide is the last slide in the recommendations for hand hygiene training in your setting. The next slides we will look at some other hand hygiene tools that you can use to promote hand hygiene competence in your setting. Ultraviolet exercises are a great way to engage staff in hand hygiene. There are many different ultraviolet products available on the market that can assist with hand hygiene training. They usually consist of a gel, a lotion or a cream that you put on your hands, and then an ultraviolet light source which you can put your hands under, which represents bugs on your hands prior to washing them. The next slide will give instructions on some of the things you can do with ultraviolet products. There are 6 steps in the following examples of an ultraviolet exercise. The first step is to ask trainees to apply UV product, whether that be gel or cream, to their hands. You could also ask them to shake a colleague's hand which is coated in UV product, or a knowingly coated device such as a pen or a clipboard in UV product. And this will teach trainees about transmission. Then ask trainees to look at their hands under a UV torch or light box to see the glow of the UV product on their hands. Explain that the glowing UV product is comparable to germs on unwashed hands. Ask trainees to wash their hands with soap and water using the correct hand hygiene technique. And then ask them to come back and look at their hands under the UV light source again to check how much of the UV product has been washed off. You can then give feedback on hand hygiene technique. For example, is a trainee wearing nail varnish or any stoned rings where the UV product did not wash off? Or did the trainee pay attention to washing the UV product off their thumbs or the tips of their fingers? Now that we have given recommendations for hand hygiene training content, as well as some examples of additional tools like UV products, we will look at hand hygiene competency assessments. It is recommended to record at least annually for each staff member and to document the name of an assessor. On the screen you will see an example of a hand hygiene competency assessment tool. You will need to make sure that the staff member identifies that hand hygiene can't be performed if they're not there below the elbow. And also make sure that the staff member can describe the 5 moments of hand hygiene and demonstrate the correct hand washing technique. You'll need to make sure that the staff member identifies that alcohol-based hand rub doesn't kill all germs, so sometimes soap and water is needed to remove the germs. The staff member should also be able to identify scenarios that require hand washing rather than alcohol rub. For example, when hands are visibly dirty, after contact with a service user or their surroundings with a suspected or known infection risks spread via the fecal-oral routes such as diarrhea or vomiting, after contact with blood or bodily fluids, after toileting and before eating. And finally, we will give some recommendations of how to complete hand hygiene audits. It is recommended to perform hand hygiene audits at least monthly, with about 10 observations over 1 month. You should collect data on staff groups, for example, healthcare assistants or nurses or doctors. Or you can record data on individuals if that's absolutely necessary. The hand hygiene audit should assess the 5 moments of hand hygiene, whether the staff member is bare below the elbow, whether cuts and grazes are covered with a waterproof plaster, whether the correct product is used, and whether the correct technique is used. In the event of non-compliance, action plans should be created and reviewed. All audit scores and action plans should be kept locally as evidence for CQC requirements. This is an example of a hand hygiene audit tool for care settings, and the link is on the bottom of the screen for you to be able to print this out and use. This is an example of a hand hygiene audit tool for general practice, and similarly the link is on the screen for you to be able to print out and use. The sections are the same whether it's for a care setting or a general practice. So you can see observation number 1, you can record the individual's name, or you can record a staff group, for example an HCA, a nurse, a carer, a physio or a doctor. And then record the key moments. Was the opportunity taken to clean their hands at each moment? Yes, no, or not applicable. Was the staff bare below the elbow, and were cuts and grazes covered with a waterproof plaster? Then observe if the correct hand hygiene technique is used when cleaning hands, and if paper towels are disposed of without touching the waste bin, if this is applicable. And that was the end of our narrated presentation. If you have any further queries, please don't hesitate to contact the NHS Kernel Infection Prevention Control Team via email, which is nhskernelccg.ipc@nhs.net. Thank you for your time.